Dr. Cynthia Weaver of Monument Health finished her rheumatoid fellowship in 1989, and she has seen the field of rheumatology expand incredibly. She says one of the most typical medications to give back then was a lot of aspirin.
Medicines like methotrexate only got approved in the 1980s. The treatments prior to that time, a lot of times, was aspirin. Sometimes you'd give people as much as 20 aspirin a day, especially for kids with juvenile rheumatoid arthritis.
The next medication that patients would get were gold shots, which used gold to help with rheumatoid arthritis. Dr. Weaver says they worked well but caused a lot of side effects.
Patients that responded to gold did pretty well, but it had a lot of side effects. It caused low blood counts. It could cause your bone marrow to kind of quit functioning very well. It could cause you to lose protein in the urine.
Dr. Weaver says in the early 2000s, the field changed when patients were introduced to biologic agents, which are small parts of a patient's immune system that are modified and sent back into the body to help the immune system not attack itself.
It was what's called a trap protein that inhibits tumor necrosis factor. And tumor necrosis factor is something that when your body produces that, it causes a lot of inflammation in the body. And so it was just a very discrete part of the immune system. But I have to say it was a game changer.
Since this change, Dr. Weaver has seen rheumatology grow and become an integral part of combating rheumatoid arthritis.
They used to tell people with rheumatoid arthritis, especially, that your chances of being disabled were about 50% in 10 years. And I never tell my patients anything like that anymore.
Dr. Weaver ends by sharing that rheumatology wasn't a fun medical field back then, as they never had medications to help patients. That isn't true anymore, as she says catching rheumatoid arthritis early is the best way to prevent it from getting worse.
Now it's really important for people to get treated early, because if we can help to slow or stop it before you have a lot of damage to your joints, then you don't go on to have a lot of disability or inability to do things. So it's probably a good idea that if you think that you might have something like that, or you're having persistently swollen joints or stiff in the morning, that you should talk to your doctor and maybe be evaluated for it.